Ever wondered why is fluoride considered the magic bullet of preventive dentistry? And is it actually doing what you think it is? So, hi everyone, I'm Dr. Smiley, and today we are kicking off the ultimate fluoride series in pediatric dentistry. Whether you are prepping for university or treating your first pedo patient, you need to master the basics. So, in this video, we are going to break down the complex mechanism of action of fluoride in a simplified manner and different modes of administration of fluoride that you will use in your clinics on daily basis. So, let's begin. So, this is how a fluoride series is going to look like. So, this is the fluoride series part 1, where we are going to see the fundamentals of fluoride. In part 2, we'll study about neutral sodium fluoride and Knudsen technique. In part 3, we are going to see about APF and Brudewald technique. In part 4, we'll study about fluoride varnishes, which is one of the most important lecture in fluoride series. Then we'll study about fluoride toxicity in part 5 and defluoridation and Nalgonda technique in part 6. So, let's see what we are going to study in the part 1, that is fluoride fundamentals. So, we are going to begin with the introduction to fluoride, followed by modes of administration of fluoride, also known as fluoride delivery methods. This is one of the most asked sub-question in the topic fluoride. Whatever they ask you, whether it's fluoride varnishes or sodium fluoride or APF, this will be the part of the question. And this is one of the most important Viva question as well. And last but not the least, we have mechanism of action of fluoride. It's been described as an essential nutrient, where in the Federal Register of US and by the WHO Expert Committee on the Trace Element and Human Health. So what we need to remember is that fluoride has been described as an essential nutrient. By whom? By two people. One is Federal Register of US Food and Drug Administration, and second is the WHO Expert Committee on Trace Element and Human Health. Secondly, they have included fluoride in the list of 14 trace elements which are recognized to be necessary for physiological and normal growth and development of the body. So the first 2 points whenever you speak about fluoride or whenever you write about fluoride has to be that it is an essential nutrient. Okay, and secondly, it is one of the 14 trace elements which is required for the normal growth and development of the body. Moving forward, what do fluoride mean? The term fluoride is a Latin word which means to flow. Also, you need to know that fluoride is never encountered in elemental form and it is always found in salt form. This is one of the Viva question which you will be asked. In what form do you find fluoride? You have to know that you find fluoride in salt form always. So, what are the fluoride bearing areas in India? Now, what do you mean by fluoride bearing areas? So fluoride bearing areas are the areas where the fluoride concentration is naturally high in water, in salt, etc. So the fluoride bearing areas in India are Gujarat, Rajasthan and Andhra Pradesh, where 50 to 100% of the districts are affected. Now this is one of the most important Viva question in community dentistry and in pediatric dentistry. Also in pedo, the examiner might ask that in prenatal history, why do you ask the mother where did she stay during pregnancy? So there are many reasons due to which we ask this, but one of the most important reason is knowing if the mother lived in an area with endemic fluorosis, which helps to predict the risk of enamel hypoplasia or fluorosis in child's primary or permanent teeth. Also, it helps us in knowing whether the patient's mother lived in endemic disease and infectious area or in an area which is highly polluted. It helps us to know about the child's health. Moving forward, so what are the sources of fluoride? This is also one of the most important Viva question. Your examiner might ask you, how will you complete your recommended daily allowance of fluoride? So what your answer should be? What will you consume to complete your RDA? It's fishes, jawar, banana and potatoes. They have high concentration of fluoride. Okay, so consuming this helps you to complete your RDA of fluoride. Next, we come, now these are the things which have highest concentration of fluoride. Okay, now talking about the geographical area which has highest concentration of fluoride, then it will be Lake Nakuru. It has the highest concentration of fluoride amongst all geographical areas, which is about 2800 ppm. Now, which food item contains most amount of fluoride? Then it's tea leaves. It contains approximately 56,640 ppm of fluoride. And now the last question, which part of the tooth has highest concentration of fluoride, and it is cementum. This might be your MCQ, that which part or which hard tissue of the teeth contains highest concentration of fluoride. Remember, it's not enamel but cementum which contains the highest concentration of fluoride. And how much concentration? It has 4500 ppm. Now, fluoride can cross the placental barriers, and this is harmful for the fetus. Why? Okay, why is it harmful? We know that fluoride is very beneficial for us, but also we need to know, while fluoride is beneficial for teeth post birth, there is no known benefit to the developing fetus teeth from maternal consumption. So therefore, excessive prenatal exposure can actually lead to dental fluorosis of the primary teeth. Okay, so there will be mottling of enamel. So what do we need to remember here? That fluoride is very beneficial, but when? After the birth, post birth. Before the birth, fetus does not have any benefit from fluoride, and the fluoride can cross the placental barriers. So the fluoride consumption of the parent or the mother should be supervised. Now we come to the modes of administration of fluoride, also known as fluoride delivery system. This is one of the most important asked sub-question in the topic fluoride. In every LAQ related to fluoride, you will find this as the part of question or as a sub-question, that what are the modes of administration of fluoride, or what are the fluoride delivery methods. So let me simplify this for you. So modes of administration of fluoride. How do you administer fluoride? It can either be a systemic administration or it can be a topical administration. What do you mean by systemic administration or systemic fluorides? So systemic fluorides are basically the fluorides that circulate through blood. Okay, these are the fluorides that circulate through the bloodstream and are incorporated in the developing teeth. So here they provide a low concentration of fluoride over a long period of time. Your best example is water. You drink water daily. So there is a very small amount of fluoride in water. So there is continuous low concentration of fluoride administration over a long period of time via water. Okay, and then there is topical administration. So what do we mean by topical administration? Here the topical fluorides are used which are placed directly on the teeth. Now there are some preparations which will provide a high concentration of fluoride over a short period of time, which are the professionally applied fluoride. So there is high concentration of fluoride in short period of time. And then there are other preparations which will give you continuous low concentration of fluoride over a long period of time, which are the self-applied fluoride. I hope we are clear about this. So we have systemic fluorides or systemic administration of fluoride, and we have topical fluorides or topical administration of fluorides. Right? Systemic administration is where the fluoride reaches via blood. Topical administration when it is directly applied on the teeth. In topical application, we have some fluorides which are applied in high concentration over a short period of time, which are the professionally applied fluoride. Then we have some fluorides which have lower concentration of fluorides which are applied over a long period of time, and they are self-applied fluoride. So in systemic administration, as we talked earlier, we have water. So we do community water fluoridation, school water fluoridation, milk fluoridation, salt fluoridation, sugar fluoridation, and we have dietary fluorides. Now it's very easy to remember here. One thing you'll remember in systemic administration is water. The second is milk, salt, and sugar, right? So we have community water fluoridation, school water fluoridation, milk, salt, sugar fluoridation, and the last one is the dietary fluorides. Now we have topical application. In topical application, as discussed earlier, we have professionally applied fluoride, self-applied fluoride. The difference we discussed, that in professionally applied, we have higher concentration of fluoride over a short period of time, whereas in self-applied, we have low concentration of fluoride over a long period of time. Also professionally applied, as the name suggests, it's applied by the dentist. Self-applied, it is applied by it's applied by you yourself. Okay. So in professionally applied, we have neutral sodium fluoride, stannous fluoride, acidulated fluoride, amine fluoride, fluoride varnishes, and fluoride gels. Whereas in self-applied, we have fluoride dentrifiers, one of the most known example is Colgate Total. Then we have fluoride solutions, we have fluoride prophylactic pastes, and we have fluoride mouth rinses. Okay. So here you will always be asked about neutral sodium fluoride, acidulated phosphate fluoride, sorry, I forgot to write phosphate, and fluoride varnishes, as they are currently highly used in dentistry. Okay, and in self-applied fluoride, you will always be asked about fluoride dentrophysis. It is one of the most important question asked in pediatric dentistry. So it is an SAQ which will always be asked, and these all are LAQs. Okay. So how do we remember it? Now we remember it as SS, which is S2, AA, which is A2, and then we have FF, which is F2. S2, A2, F2. From S2 we have sodium fluoride, stannous fluoride. From A2 we have acidulated phosphate fluoride and amine fluoride. From F2 we have fluoride gels and fluoride varnishes. And in self-applied, it's very easy to remember. Just remember your oral hygiene routine, oral healthcare routine, which is dentifrice, a toothpaste, a mouth rinse, and fluoride solutions and fluoride pastes. I hope we are clear. Now, there are some fluoride preparations which has systemic as well as topical effect. Okay, some preparations have systemic as well as topical effects. What is the example of it? It is fluoride oral rinse supplement. What is it? Fluoride oral rinse supplement. Now, how they are used? Now, you keep it in your mouth, swish it in your mouth for a topical effect, and then you swallow to provide a systemic effect. So it is also one of the most important viva question. Is there any third type of fluoride administration? So you say yes, there is, where systemic and topical application or systemic and topical administration comes together, and they are fluoride oral rinse supplement. Now moving forward, we have mechanism of action of fluoride. So this is something very basic and fundamental, and it will always be asked as a sub question in an LAQ. Okay, any LAQ related to fluoride will have a question that please explain the mechanism of action of fluoride. Okay, so as we saw earlier, there are different types of fluoride: sodium fluoride, stannous fluoride, acidulated phosphate, amine fluoride, fluoride varnishes, etc. And all different types of fluoride have slightly different mechanism of action, but their basis, their foundation remains the same. So we are going to study about the basic mechanism of action of fluoride. So there are multiple mechanism of action that has been identified, which are basically assumed to work simultaneously. Okay, there are number of mechanisms. We cannot say that there is a single mechanism of action of fluoride. No, fluoride works in several ways. Okay, so the first and foremost thing that fluoride does is that it increases enamel resistance, or we can say that it reduces the rate of demineralization. Okay, it is easier to understand this way. Okay, so the first thing it does, it strengthens the enamel. Okay, it increases the resistance of enamel, and therefore it decreases the rate of demineralization. So now enamel is less susceptible to caries because it is stronger. It does not undergo demineralization as fast as it used to go earlier. Secondly, it increases the rate of post-eruptive maturation. So how does it help? And what does this mean? This means that it increases the rate of mineralization. Okay, once the tooth has erupted, it has to get mineralized, right? It has to get matured. So fluoride increases the rate of mineralization. Third, we have that remineralization of incipient lesion. So what happens whenever there is an attack on the tooth? There is an acid attack on the tooth by bacteria, which causes caries eventually. So first we have an incipient lesion. The lesion is in their starting phase where the enamel can be remineralized. Okay, so what happens here is that fluoride helps in the remineralization of enamel. Which enamel? Which has an incipient lesion. Then Fourth, we have it that it interferes with the plaque microorganism, and last but not least, we have that it modifies the tooth morphology. So the five, it is very easy to remember, okay? The 5 ways by which fluoride helps is, first is that it reduces the rate of demineralization, it increases the rate of mineralization, then it helps in remineralization, okay, then it interferes with the plaque microorganism, and it modifies the tooth morphology, okay. So these are the 5 ways by which fluoride works. So with this we come to the end of our lecture, but we have a short test time before we complete this lecture. So the first question is, which calcified tissue of the teeth has highest fluoride content? Yes, you're right, it's cementum. Then fluoride supplements are which mode of administration of fluoride? Basically I mean fluoride oral rinse supplement are which mode of administration of fluoride? Yes, it's both systemic and topical. And the last question, what is the most common method used for fluoridation? It's very simple. Which method would help many people, a lot of people? It is community water fluoridation, okay, because water is the primary need. Also, we use water more than salt and milk, right? Water is the primary need, and in school water supply, the water will reach only to school children, whereas in community water supply it will reach to a larger mass of people. So therefore community water fluoridation is the most common method of fluoridation. Now this is the last question for you. Please leave the answer for it in the comment box. What is the recommended daily allowance for fluoride? So that's all for this lecture, and with this we come to the end of the foundation of fluoride. In the next video, we are diving into the Knudsen technique, which is the clinical standard for sodium fluoride application. So don't forget to like and subscribe and to complete the series with me. You will find the link for the next videos in the description. So keep learning and I'll see you there. Bye bye.